Can spinal stenosis be cured? That's a question that a lot of people would like the answer to. In this video, we're not only going to answer whether or not spinal stenosis can be cured, we'll help you discover exactly what's going on, the best way to treat spinal stenosis, and what the word cure actually means so that you can get back to the life you deserve and do the activities that you were meant to do. Please stay to the end where we discuss one of the biggest mistakes people make when trying to deal with spinal stenosis. Hi, I'm Dr. John Zielonka. I am the founder of the Center for Non-Surgical Regeneration right here in our nation's capital, Ottawa, Ontario, Canada. I'm the past director and founder of the rehabilitation program at the Ottawa Sports Science Center, having seen some of the best athletes in the world. I'm the author of the bestseller, Low Back Pain is Not a Life Sentence. And for the past 35 years, I've been an award-winning chiropractor, again, right here in downtown Ottawa, where I've laid my hands on hundreds of thousands of spines. I'm here to tell you that I understand your pain, and there are a lot of things people can do. If you've been suffering with spinal stenosis, often it just seems so debilitating, so much despair, and that's the thing, it will affect the aspects of your mental health as well. It will affect all aspects of your life, where difficult to walk, difficult to stand, and so forth. I'm here to tell you that it's not your fault, and there are things that can be done to get most people better. So what is actually happening with spinal stenosis? So again, let's understand what those terms actually mean. A lot of doctors, a lot of health professionals try to make this more complicated than it should be. Stenosis, literally translated, simply means narrowing. Now, the fact that it's a simple explanation doesn't mean that it's not causing some serious problems in there. There are really two types of stenosis. So we're either narrowing in the spinal cord itself, so that would be central stenosis or spinal stenosis, and you do not want to narrow the spinal canal that's going to compress on the entire spinal cord, because you can affect all of the nerves that then exit off that spinal cord at that level. There's also what's called foraminal stenosis. So that term, the opening where the nerve comes out, is called the foramen. You want to know what foramen means? It means opening or passage where that nerve comes out. So again, if we've narrowed the spinal cord, we're going to have symptoms. We're going to have dysfunction. If we're narrowing the opening where the nerve comes out, again, we're going to have symptoms. We're going to affect function. The difference is going to be if you're actually narrowing the entire spinal cord, then often those symptoms can come down both legs or down both arms if we're talking stenosis of the neck. Foraminal stenosis, then obviously it's going to be on that one side where that foramen actually narrowed more. Very similar to heart disease. So when someone says they've got stenosis, they're narrowing the blood vessels. Obviously, we don't want to do that. So can that be cured? Well, so again, the term cure, we have to take this with a grain of salt here. Will an 80-year-old magically open up that spinal canal so that they're back looking like they were 12 years old again? No. What they can do is there are things that can be done to actually help take some of the pressure off those areas. Because again, what's happening is you're narrowing that. All the people with spinal stenosis, those are the people you see, especially seniors in grocery stores, who are all leaning forward over the shopping cart. And the reason they're leaning forward over the shopping cart is what that does is that literally causes the vertebrae to move this way. And if you're doing that, you're then opening up back here, and that's taking some of the pressure off those nerves. Now, that's the exact opposite of disc herniations. We've already done the video on that as well. And a disc herniation is like a jelly donut. So if I squish the front of the jelly donut, the jelly's coming out the back. So that's why people with disc herniations do not like bending forward. It actually puts a lot more pressure on those disc herniations and bulges and prolapses. Whereas people with stenosis actually like to lean forward. It takes that pressure off. And then the reverse is true as well, is people with disc herniations can actually lean backwards because they're not squishing that jelly donut the same way. But people with stenosis do not want to lean backwards. That just jams it up that much more. So what we want to do is we then want to deal with all those causes of what is actually creating that stenosis in the first place. There are really three things that add to stenosis. So number one, we've talked about this in our past two videos, is number one, if I have a disc herniation, that disc herniation doesn't just come backwards. That disc herniation can go and actually start to squish that spinal cord if it's actually going in that direction. That's going to narrow that space. When we talked about degenerative disc disease in the last video, well, those spurs and that degeneration doesn't just go outward, that can actually go inward and again actually start to narrow the spinal cord. And then last but not least, which we'll get to in a future video, is spondylolisthesis, where the vertebrae actually shifts forward on one another. And if you're doing that, you're not just pinching the nerve or putting pressure on the nerve, you're going to tense that spinal cord in there as well. So if we understand that those are the three things that actually add to stenosis, obviously we then need a treatment that's going to address all of those. So we've already talked about how we can deal with disc herniations. We've talked about how we can deal with degenerative disc disease. And in a future video, we're going to talk about how we're very successful in this clinic anyway with actually helping to reverse spondylolisthesis. So here, again, it's a term that I don't want to use. You're not going to go back to being 12 years old again, but there are things you can do to actually take some of that pressure off that spinal cord, take some of that pressure, off those discs, or off those nerves if it's the foraminal stenosis. And a lot of our patients do actually start to get far more mobile, because the stenosis people, those are going to be the people who can't stand for long periods of time, can't walk for very long periods of time, and so forth. And unfortunately, all the painkillers, all the drugs in the world are not going to fix that. So what do the clinical studies actually say about stenosis? They actually show over and over again, and especially in this clinic as well, that we can see improvement in that stenosis. And again, addressing all the three things we were talking about, getting to all of the underlying causes, which again, we talked in our past videos is one of the biggest mistakes, is how on earth do you fix something if you don't even know what's going on? You can't be taking shots in the dark, hoping that that might be the one thing that gets you better, because what that's going to do is, might give you temporary relief. So temporary relief is nice. There are times you need to break that chronic pain cycle, but drugs aren't going to do that for you. All the muscle work in the world is not going to do that for you. It doesn't mean you don't need muscle work. It just means it's not going to fix the actual underlying cause of the problem. Is you need to create some more space in there. You don't necessarily want to go the surgical approach, because the surgical approach is what we call a laminectomy. So what they're going to do is they're going to cut away all that bone back there, thinking they're giving you more space. Long term, that's not always a great solution. And for some people, that's going to create problems down the road. Plus, there's a long recovery period. Plus, there's going to be scar tissue formation, plus the risks and so forth. So what we want to do is we want to get to all the underlying causes. In our clinic, again, we use non-surgical robotic laser spinal decompression, and it's great for addressing the three things that actually speed up that stenosis. So if we can do that, what a surprise, the stenosis often gets better in there as well. If you're finding this information helpful, please please share. There are a lot of people suffering with this that don't need to be suffering with this. The place to start is with a full consultation and exam to get to all the underlying causes of the problem. Now, if you've enjoyed the 3 videos in this series, there's going to be a second series coming up where we'll be talking about sciatica and failed back surgery, and as we said, even spondylolisthesis as well.